Okay. Ready? Well, good morning, everyone. Thank you so much for joining us this morning. I'm happy to welcome you here to Southern New Hampshire Services. We're the Community Action Partnership serving both Hillsborough and Rockingham counties. We serve people of low income, and today's subject matter is critical to the families that we serve. I would like to begin this morning by introducing Governor Sununu, who's going to talk to you about our subject matter of the day.
Okay. All right. Well, thank you. Thank you very much. Today is a very exciting day. You know, when I became governor back in 2016, New Hampshire was always known as having fairly high health insurance premiums. It's just where we were. It's because of different things we had in the law and different rigidity that we had in our system. And when we applied originally in 2019, I believe it was 2018, 2019 for our original waiver from the federal government, that allowed us a little more flexibility with the hopes of actually reducing premiums. And these healthcare premiums affect every single family. All of these families that have to pay all of this kind of sometimes very painful, if you will, dollar amount that has to go every month, knowing that sometimes they have to carry high deductibles as well as whatever it might be. It really puts a huge financial strain on families that just want reasonable and affordable healthcare. Over the past couple of years, we've been able to really buck the trend. In the first year, I think we saw almost a 20% decrease in premiums, where we continue to buck the trend. And now not only are we not at the top of that list, we now beat the national average in terms of our market plan premium, and we are the lowest in New England. I mean, those are huge benchmarks that the state of New Hampshire has now hit. It's really incredible. And obviously, there's still a lot more work to do. It's the type of project, if you will, that is ongoing. You're always challenging yourself to find more flexibility, find ways to decrease that dollar amount, so our private health insurance really just becomes more and more affordable for families. Every dollar in their pocket really does matter, and the more affordable it is, the more folks you're going to get to participate in these plans. Now, we took some executive action early on, but none of this is possible without a great team. And we've had very good teams at the state level with our community partners who have been very instrumental in giving us the feedback, having us understand what works, what doesn't, where the barriers are. And with that data and that information, we're able to go after these waivers, go after the flexibility, and then design a system that really caters to the financial needs of New Hampshire's families. So next, I want to introduce our Commissioner of Insurance. The entire insurance department and Commissioner Nicolopoulos has just done a phenomenal job over the past few years. We can't thank them enough. Without them, while we wouldn't be in the very favorable position where we are today, we wouldn't be able to making a very positive announcement for the state of New Hampshire. And we just can't thank them enough for all the work they do. Commissioner.
So today marks a big day. Today is the first day of open enrollment for 2022. Open enrollment will run from November 1st till January 15th. And we're fortunate that here in New Hampshire, we have three health insurance companies who are participating in our individual market open enrollment process. And those are Ambetter, which is New Hampshire Healthy Families, Anthem, and Harvard Pilgrim. And whether you have a plan currently in 2020 or you're looking at what plans might be appropriate for your family in 2021, we encourage you to go to Healthcare.gov and look at the options. There are various options for people. It's important to note that many citizens will qualify for credits or discounts or even reduced cost-sharing amounts for their 2020 or 2021 insurance products. Federal government's recent guidelines have allowed premium reductions for people earning even over 400% of poverty levels. So we recommend that you go to Healthcare.gov, review and purchase individual health plans. But we also recognize there are other avenues to look for individual health plans. You can go through an independent agent. You can go to companies direct. But as a warning to folks, if you're looking for health products and something seems too good to be true, we encourage you to contact our department at the New Hampshire Insurance Department at 1-800-852-3416. Or you could always email our team at consumerservices@ins.nh.gov. This is a tremendous opportunity to get yourself and your family covered for 2022, and we look forward to supporting you in any way we can. Thank you. And now I'd like to introduce Christine Santaniello, who's Associate Commissioner of DHHS.
Great. Thank you, Commissioner, Governor, and Donnalee for hosting us here today. We are so happy to be partnering with the New Hampshire Insurance Department and our providers to ensure health care access to the people of New Hampshire. Open enrollment is such a critical and important time for New Hampshire. For us here at the department, as we begin to assist people with health coverage at the end of the federal public health emergency, the collaboration among DHHS, Department of Insurance, and the Navigators to assist people with affordable health care coverage is critical. Affordable health care coverage is critical for New Hampshire families. It is a key component to mitigating the cliff effect as families come off of health and economic assistance and enter the workforce. We are fortunate to have many of us working together to support our families, individuals, and ultimately the citizens of our state. And now I'd like to introduce Elias Ashooh, one of the Navigators.
Thank you. So, I'm Project Director for Health Market Connect, and I know we are so proud to bring back an in-state presence of Affordable Care Act Navigators. For those who don't know, Navigators help consumers assist and enroll in the individual marketplace, all at no cost and unbiased assistance. And really the Navigator program, we designed it for New Hampshire to serve New Hampshire and make health insurance more accessible for families across the state, really to provide a localized support on a statewide basis. So we have 10 community navigators that are located throughout the state, and they come from a wide background from health centers and other social service organizations. But a big piece that I'm really proud to say is that of the 10 navigators we cover a half dozen languages, including French, Spanish, Nepali, Hindi. So we're able to give direct assistance to the thousands of New Hampshire residents that have limited English proficiency or maybe don't speak English at all. So they're able to get support, figuring out their health insurance options from people who live in their community and speak the same language as them. So our 10 navigators are connected through what we're calling a community embedded call center. So anyone in New Hampshire will be able to get in-person assistance or virtual, all at no cost, unbiased. We know, especially in the past year and a half, how important it is to be healthy and to protect you, your family, and your community. Now with open enrollment and unprecedented assistance for New Hampshire consumers, there's no excuse not to be covered with health insurance. We'll be able to meet you wherever you're at, provide assistance, and make sure you get the coverage you need to protect you and your family. So our phone number for our community embedded call center, 603-309-2021. You can also email at help@hmcnh.com. And so the navigators are here all across the state, and we're ready to help. So thank you for having me. Now I'd like to introduce Jeremy Smith from First Choice Services, the other operator of the Navigator grant in New Hampshire.
Thanks, everybody. My name is Jeremy Smith. I'm the program director for the New Hampshire Navigator program operated by First Choice Services. And I find myself, as I got here today, thinking back on the work that we've done. I've actually been a health insurance navigator since 2013. This has, been a huge part of what I've done with my life. And I've gotten to speak at press conferences that the White House invited me to. We was able to talk at an event that the HHS secretary put on a few years ago. I've been able to do a lot of really exciting work, but when I thought about what we're facing today, I think I'm more excited than I've ever been. And the reason is because we have the resources in place to help a lot of people this time around. The rates are really good. Almost everybody will be able to get a very affordable health insurance plan. And for the first time ever, we've got just a huge amount of capacity in terms of navigator assistance to be able to help people select insurance plans and make sure that they get all of their questions answered and they can get good quality insurance. So the way we got into this is First Choice Services is a nonprofit organization. We specialize in social service helplines. And a few years ago, the Navigator program had gotten cut down pretty bare bones. and there was no Navigators in New Hampshire for a couple years. So we went ahead and wrote the application to help New Hampshire residents through a call line. And we've been doing that for 2 years, and we was just able to get renewed for a third year, or for another cycle. And this time around, we're even happier with what we're going to be able to offer, because we was able to bring on the ground partners with us. So not only will we be offering the phone assistance that we have, but we've also been able to partner with Lamprey Healthcare, Harbor Care, and the Foundation for Healthy Communities, so that we can have in-person assisters available through them, and then also for our call line. So we're just really excited to be able to help people and make sure that they get good quality health insurance. So we're going to be working closely with the other Navigator organization as well. They have a lot of great services, and then of course with our call line, we can offer assistance in English, Spanish, and we have a translation service on our call line to be able to help any language that from somebody that calls in. So if somebody does want to link up with one of our Navigators, you can reach us Navigator.com or 603-931-3858. And we're just really excited about this whole program this year. I'm super happy of how everything's turning out. So appreciate your time today, and I'm going to turn it back over to our gracious host to finish everything up.
Thank you. When I opened, I was trying to save the subject matter for the governor to announce, because it's so important, and the governor has really been a significant part of our whole family approach work, the cliff effect work that Chris mentioned, and so many things that help our families to be stronger New Hampshire families. We're a small state. Partnerships matter. How we do things matters. And easy phone calls to each other. You know, I'd like to thank Elijah for training some of our staff already, preparing them to help our clients be able to get health care and understand. You know, the commissioner gave a lot of information about how it works, but at the end of the day, the takeaway is we all need health insurance. It's not only good for the families we serve, it's good for the employers that want to employ people but can't afford to offer health care. So all of these linkages really make a difference to keep our community healthy, safe, and help our children grow into strong adults. So I'd like to thank everybody for coming today. We were happy to be asked to host. I'd like to thank my board chairman, Senator D'Alessandro, for coming this morning. And again, the other nonprofits that are out there in the community that are serving clients, take the training, be able to help. We all know that at open enrollment time at our companies, it's a busy time. So when you think open enrollment for yourself, remember your clients and help them navigate the waters. Thanks so much for coming today.